Good evening, everyone, and thank you so much for joining us for this virtual information session. It is certainly a school year unlike probably any of us have ever experienced. And you have a lot of questions, so do we. And tonight, joining with Stormont Vail, we hope to have some of them answered for you. Students are beginning to return to school. We're all a little or maybe even a lot worried about what we can do to keep school-age children safe and happy during a global pandemic. Stormont Vail has assembled a team of experts tonight to help get those questions answered for you, to not only provide some clarity, but also peace of mind and get those important questions answered. Tonight, we are honored to have with us Dr. Mary Wilson. She is a clinical psychologist at Stormont Vail's Behavioral Health Center. Also with us is Dr. Clif Jones. He is Vice President of Specialty Services, and he is an infectious disease expert at Stormont Vail. Thank you so much to both of you, because really there are two parts of this pandemic and how it has impacted children and families. Certainly the physical part and our physical health and well-being, but also our mental health and well-being and all those anxieties that we're experiencing really no matter what age we are. So you can ask our questions, or ask your questions rather, tonight of our COVID-19 experts here on how you can support your and your child's mental and physical health and well-being. We will do our best to get as many of them answered as we possibly can. So Dr. Jones, Dr. Wilson, thank you so much for sharing your thoughts and expertise with us. People, feel free to drop your questions in the comments section. We'll get to as many of them as we can. You know, we know that in some ways this has become an issue that some people have politicized. We're not here to say anything right, what's wrong to think or feel this evening. We're simply here to give you the best knowledge and information that Dr. Jones and Dr. Wilson are able to provide. So with that being said, Dr. Jones, you know, we're talking about the age population of children. What is the risk to children in general, but also no matter the age range that we're talking about, whether it's the younger children in elementary school all up through the college years?
Part of that is still not completely understood. There was a dramatic impact on, I believe, and I think others believe this also, on the pediatric population in the spring of this year when schools closed right after spring break, especially in the Midwest, before we had cases, opportunities for people to be exposed. So we did see, it has been shown, at least in the first several months of the pandemic in the United States, that the childhood age groups were significantly less affected. It was initially felt, and there may be some evidence that there's less risk of infection. It's more likely that there's maybe a little bit of that, and then a significant impact of more commonly asymptomatic infection in the pediatric group when they do get infected. Certainly there's a spectrum of illness as far as from asymptomatic to severe illness in people of all ages. It's amplified by health risks, underlying or associated health problems. And that's as true in the pediatric age groups as it is in the older adult age groups. But it would appear that on the whole, the very young appear to be less likely to get infected, and if they are infected, more likely to be asymptomatic. Older children, adolescents, the high school age group, college age group, would appear that their spectrum of illness is more similar to older adults. But again, an age-related predictor of complications that becomes significant the older you get, well beyond the childhood age groups.
When you talk about those risks, though, Dr. Jones, I imagine it should be said that much like influenza, and as much as we don't like to compare COVID and influenza, there can be more severe complications and consequences regardless of age.
Yeah, I did mean to say that. I think that is true, and at all age groups there's risk. The risk of hospitalization, the percent of population exposed and known to be infected that require hospitalization is less in children. It's higher in age groups as you get older. But the spectrum of illness includes very severe, life-threatening, and potentially fatal illness at all ages, with predispositions that may predict further increased risk at all those age groups.
Thank you, Dr. Jones, for addressing that. Dr. Wilson, We've seen video and images from classrooms, people walking around in masks, which can bring up its own anxieties, shields in between desks, maybe not being able to interact with your teacher the way you've always been able to. How do you prepare your child mentally for this new school year?
Well, what we know is that kids do better when things are predictable, when they can anticipate what's coming, when they have some structure and some routine. So if your child isn't in class yet, finding out as much information as you can about what their day will be like, what the changes will be, making sure some of the basics that we always do, making sure their sleep schedule is back to a school schedule so they can wake up and be ready to work. Having a place at home where they can do work. Many of our districts are doing hybrid, where kids are studying and learning at home. So thinking about what your child needs. If you have a child who's more easily distracted, maybe you want to set up a cardboard box or a trifold poster to give them a little bit of space. Noise canceling headphones might be helpful. Some kids would do better in a room with their parents. Some kids won't. And as far as preparation too, thinking about what your child needs if school hasn't started yet. If you've got a child who tends to be on the more anxious end of things, practicing as much as you can. Maybe you can't do a school visit, but you can drive through the drop-off lane or walk to the bus stop and kind of begin to rehearse what you can and what's still possible.
That's a good point. I've seen some people bring up in their back to school stories. Normally, parents can walk their child into the building, hold their hand when they get to that classroom, and have that kind of a little bit ease of transition, especially when you talk that kindergarten, first grade age, being able to stay with the child at least for some small period of time, make sure they're okay, and then you leave the building. That's not happening this year. The kids are going in there on their own. So what sorts of things can a parent do to let the child know that they really are going to be okay?
Well, if your child has really severe anxiety, then it's definitely worth reaching out to school staff. So you can come up with a plan so that your child knows what to expect. Even if it's more on the more typical level of anxiety, coming up with a ritual for saying goodbye, so that your child knows that, okay, we're in the car and in the drop-off lane, we kiss goodbye and say have a good day and then head to the building. And it's, again, thinking what works for your family, but keeping what you can control as predictable and consistent as possible.
And then for those who've already gone back to school, what questions should you be asking the kids at the end of the day just to kind of check in and know that what they experienced was okay? Because I'm thinking things like, yes, keeping the mask on all day. Did you get yelled at by the teacher for not keeping your mask on? Little things like you can't suddenly, if your friend is in a different pod or group, you now can't sit with them at lunch or go to recess with them. So how do you check in with your kids and how do you ask those questions? In what way should you be asking them to make sure they're okay?
Well, and for most kids, describing events, narrating what happened at school, answering questions is a skill they need to develop. So beginning with some concrete questions. What did you have for lunch today? And then who was sitting next to you? Who did you play with at recess? And giving them practice in telling you about elements of the day so that they can begin to develop that skill and then can begin to talk to you about some of the more emotional parts of being at school.
Dr. Jones, we saw some reports come out this week that the state's orders of federal vaccines were down 20%, which then could lead to the thought that perhaps we actually are seeing fewer children up to date on their vaccines this year, especially this year. Why is it going to be so important that parents figure out how to make those arrangements to get kids up to date on their immunizations?
As I think most people realize, not a majority, but many of the childhood vaccinations are directed at respiratory infections. So even varicella, chickenpox is transmitted as a respiratory infection. Obviously, measles. Immunizations for bacterial pneumonia are given much earlier to infants and early toddlers. Complications of, as you mentioned influenza as well as the coronavirus. It can include bacterial superinfections, so vaccinations for the pneumococcal respiratory pathogen and Haemophilus influenza as well are very important. I think what I understood is it was difficult for well children to get clinic visits in late March, April, and May because elective visits to family practice doctors and pediatricians' offices were significantly limited when we had an extreme social shutdown and people were sheltering at home. I think some of that carried over through the summer that people felt safest if they weren't in a healthcare setting. And so I think there was maybe some reluctance for people to, even when they could go in for well children visits and elective visits for vaccinations, maybe people were not anxious to do so. Parents out of work, I suppose there might have been some economic constraints also as far as their ability to get their kids healthcare. Certainly right now, as most of us are thinking, we're entering the influenza immunization season. So that traditionally is September and October and can extend to Thanksgiving. I guess fortunately the influenza illness season typically, at least around here, tends to show up later in the fall. Influenza has a lot of similarities to the coronavirus syndromes as far as influenza-like illnesses. You can see a significant overlap, and there is a concern that we'll see if this happens to be a year when we have a heavy influenza burden. The hospitals are currently full with elective and non-COVID as well as COVID-19 related illness. Is there additional capacity to face our typical late November, December, and early January surge in influenza admissions and hospitalizations? So all of that enters into this whole picture of now is certainly the time to reconsider immunizations. And if there are deficiencies in a child's immunization history, any of those things should be addressed as soon as possible. Children of virtually all ages should receive influenza immunization yearly, and this year is not only not an exception, it's more important than ever to get influenza immunization as soon as is practical.
Since you mentioned influenza and COVID season overlapping, the COVID pandemic continuing while we move into influenza season, we did have a question in the comments. And a reminder, if you have any questions come up that you would like Dr. Wilson or Dr. Jones to address, please put them in the comments and we'll get them addressed as we are able to. But we had a question come in, Dr. Jones, with those two things overlapping. Is there any advice on how you differentiate between the two of them?
So there are some distinct differences, except COVID's anybody's guess because it does just about whatever it wants to. So typically the COVID illness is relatively nonspecific and subtle. Initially, it may remain that way all the way through in people that have minimal or no symptoms. Classic influenza, most people that have diagnosed influenza have a very sudden onset of illness and often fever. High fever is the first symptom. That wouldn't be typical of the way I understand the majority of COVID-19 patients. COVID-19 patients may certainly have significant fever. Influenza patients typically have very prominent respiratory symptoms fairly early, maybe right after the onset of fever. And cough and deep cough is not unusual in more severe influenza. So there is a spectrum of differences. I think the biggest difference is the COVID-19 illness typically develops over several days for people that have symptoms, and the severe symptoms may not develop for 4, 5, 6, 7 days into illness. Influenza is more abrupt and right at the front end.
And with that information, someone just asked, do you have the schedule yet for those walk-in flu clinics, or at least a general timeline of when you anticipate the vaccine will be available?
So the drive-through is scheduled for more days than we've scheduled in the past, and those don't start till October. The immunization, the flu vaccine is available in the clinics now, next week, I'm sorry. So next week is when it's available. And so it will be available to our patients starting next week.
So very good to start reaching out to your doctors about that. And we might get back to a little bit more advice on these seasons overlapping in a minute. But Dr. Wilson, I want to come back to you. Someone had commented that their child's teacher started a Facebook group so that the kids and the parents can stay connected. You know, kids aren't the only ones anxious. I have a younger sister who's a special ed teacher, and she's got all these questions as they finally went back to school this week. Things are very different for them as well. So any advice for the teachers out there on how they can approach back to school?
Well, first of all, it is very stressful for everyone. So teachers need to really take self-care in context and make sure they're taking care of themselves too. I love the idea of a Facebook group. I think it's going to be so important for parents and teachers to communicate. So if teachers can let parents know their communication preferences, the best way to get hold of them, because we know teachers are busy during the day, and how parents can reach them. Parents are also going to need some clarity about their role. Last spring, we were all kind of thrown into this schooling from home, and parents took on a really active teaching role. But now that educators have had some time to prepare for the new school year, letting parents know specifically what they need, and providing parents specific information about how to keep track of your child's assignments. Well, I talked earlier about routines, and the more that teachers can share the way their day is organized, the way their classroom is organized, kind of the typical ebb and flow of the school day, then parents can use that information, and it won't be exact, but on the days when kids are home, they can begin to kind of mirror that so that their child can stay on a consistent routine.
Routines, I imagine, would be very important for the teachers as well, and communicating what their routine is going to be, because just like kids and parents, the teachers are probably going to have to figure out what their schedule is going to be so they can have that work-life balance and reduce some of their stress as well.
Right. And setting those boundaries for everyone, whether you're a teacher working part-time from home, a parent whose child is learning at home, having that clear separation between time at school and family time is so important to keep stress levels down, to keep healthy coping in place.
We had a question as well, Dr. Wilson. Kids love to interact. They love that face-to-face interaction. A lot of them do interact via screens for gaming and things. And the advice has been to limit kids' screen times and encourage more face-to-face interaction. This virus has kind of tended to have to flip that on your head. So what advice do you have? Should you still encourage kids to interact with their peers using the screens, even though that's going to mean more screen time overall?
Well, I think it is a balance. We don't want kids to spend all their time on screens. At the same time, socialization is so important, and they need those positive socialization experiences. So it may be that you've got a teen who spends a little more time on Discord, or you help a elementary school student FaceTime a friend, because the in-person play dates, the in-person activities just aren't happening as much anymore.
Dr. Jones, thinking about those in-person social interactions, obviously you can control a classroom setting because the kids are being spaced a certain distance apart. So if there are going to be those in-person interactions, any advice for how to keep them safe in terms of maybe limiting the length of them, limiting how often they happen, limiting how many kids there are there, and what sorts of practices to keep in mind if you are going to have kids in person together?
Well, so many layers to this whole thing. So it's the population, in this case, the kids that are getting together, are they already infected, or if they are not, and their environment, what are their exposures? Are they in a family that is able to do whatever they can to create a bubble of a home where there are limited exposures to that family? Is it a family where the adults in the family, young adults, are working in jobs where perhaps they're not able to be socially distant all the time, or not comfortable, or not aware of the value that they might achieve as adults in that workplace, wearing face mask, face protection. So all of those things enter into it. What are the children that are interacting? What are their environments? What is their likelihood of being infected coming into it? the science, there's really amazingly good and precise science behind social distancing. That's not just some random thing somebody came up with. They studied this a number of years ago with the original SARS coronavirus, and with the second coronavirus, the MERS virus, a number of years ago. And we're able to statistically show a lot of significance in any distance at all from an infected person to a non-infected person, but it dramatically increased from 3 feet to 6 feet. And so that's where that came from. So that is real. That is scientifically valid. The face mask literature is also very strong. And a lot of the confusion that entered into this dialogue started out when just about everybody in healthcare had a deficiency, a shortage of face masks. And it was clear that if people were taking them home from work in a healthcare setting to have stockpiles at home, people were using them in general population. There might not be enough for healthcare workers. So that message, all these things that we've learned over months, not we, but collectively that have been learned, are evolving and changing. But it's very clear that in settings where social distancing is present or where it's not possible, face masks will make a huge difference, a significant difference, especially in by necessity if both parties are wearing them. So if we know children are going to be children and they're going to be interacting and they're going to be with each other, the distance is probably the most crucial thing, and that's probably the most frequent thing that'll be violated. Time and duration is also very significant. I think it's a little bit more arbitrary. The 10 minutes was arrived at as a easily remembered and reasonable amount of time as far as what defines moderate or higher risk exposure. But that's also cumulative. And so if you have a play group and you have people interacting over a prolonged period of time, it's going to be very difficult, probably not possible to avoid a cumulative total of at least 10 minutes of contact if somebody in that group happens to be infected. So the layers start with the people in that group. You'd want to have some assurance and some expectation that they're not entering that group as a carrier or as an infected individual. Take that back a further level, and people participating in that group or participating in extracurricular activities or participating in school, people that work with us in the hospital, we don't want them to come to work if they're ill. So that's, another safeguard is that people are honest about symptoms and understand that if they're having symptoms that could potentially be attributable to COVID-19, that's going to be a responsibility. Again, I'm straying off your question. Again, we are expecting children participating in these kind of interactions with other children to get some guidance from their parents. In the school setting, they're going to get guidance from the people that work at the school and are working with them during the school day. But at home, before they come to school, after they're at school, they're going to need some help remembering all of this.
Yeah, those are all very good reminders for people of any age, really. So I appreciate you going through that whole layers and the whole social bubble thing that we've been starting to hear about a little bit more. Part of that, what you said, was the wearing the face masks. So really for either of you, and maybe Dr. Wilson, because it's something that can tend to bring up anxiety, any advice for parents on how to address the concerns about whether their child will be able to keep their mask on?
Well, I've been actually very pleasantly surprised in my practice. I see lots of kids with ADHD, kids with autism, and I've been amazed at how many kids that I thought would really struggle are actually able to tolerate a face mask. It seems like kids, just like anything, kids like having some choice. So if you can allow them to pick out something about their face masks, choose one they like, it may take a couple of different styles to find one that your kid can tolerate for a while. If they're bothered by the earpieces, then maybe you want one that ties behind the head. If it helps to have Paw Patrol or their favorite video game on the mask, then that could be helpful as well. Practice at home, just learning what it feels like, getting used to breathing back warm air. And if parents model wearing face masks, it'll be much easier for their kids. It's just like seatbelts. We model buckling our seatbelt as soon as we get in the car, and kids learn.
A question, Dr. Jones, has to do with the COVID-19 vaccines that are currently in development. The announcement came out yesterday telling the states to prepare to have it perhaps by November, which doesn't necessarily mean it will be available come that time. But when it is available publicly, perhaps after the first of the year, how can we be sure of its safety and effectiveness?
Great question. It takes a level of trust, and we have vaccines that have been in place and been employed and been used and offered and recommended for decades. And overall, safety record and benefit record is scientifically clear, but obviously not everyone agrees with the data and with the recommendations. This particular virus, there's so many different parts of the virus. People are investigating different types of vaccines, different component vaccines. Some are live attenuated vaccines. Most of them are not. There's no way right out the gate that it's possible that the very first vaccine available will be the very best one, but nobody's really expecting that. Expect to be refinements as time goes forward. They're going to, in the US at least, there's going to be these phase 3 trials with large numbers of individuals. And so the numbers of the 30,000 people that are getting that vaccine in each one of these trials, if that's the correct number, they can predict what the common adverse reaction profile will be. It'll probably be very similar to other respiratory viral vaccines, probably fairly similar to influenza. Efficacy is the other question. I'm an optimist about this. I think there'll be some benefit to the earliest vaccines. It's not going to be 100%. Who knows where it'll be. Influenza varies, and we've been provided with influenza immunizations for decades. And some years, even when it's matched for the circulating strain that's in the community, some years it's 20% effective, some years it's 60% effective. I do feel that even in influenza, when the vaccine efficacy is a little less, it's not as good at preventing infection. It probably modifies severity of illness. The initial vaccine isn't likely to be the best vaccine, if that's a simple answer to the question. It will be safe enough that I will recommend it to patients. It's not going to be released if there's some drastic and unexpected adverse events that occur in the trials, but my expectation is it's being developed quickly but carefully. There'll be safety profiles that will be available for our review and consideration. And again, I would personally recommend it for people that have health risks, and for healthcare workers, and for the general population, probably in that order.
Very good. And we'll wait for news. It seems like something new is coming out every day when it comes to that vaccine development. Dr. Wilson, a question from a parent, and it's a good one, especially for children who are very social beings, even adults who are very social beings. A study just came out talking about how the depression rates may have increased even more than we're even aware over these past 5 to 6 months. So when it comes to our kids in particular, what signs can we look for that there is some anxiety or even depression that's developing?
I'll talk about depression first. Depression often looks really different in children and adolescents than it does in adults. For some kids, it is sad and depressed mood. For other kids, it's irritability. So just kind of a chronic waking up in a bad mood, having really, really easily frustrated. So it may look like irritability and anger, but it's actually depression. Another big warning sign is if they lose interest in positive activities that they used to be interested in. So if you have a younger kid who loved to play with Legos and now they won't, or an older teenager who liked to go for walks and now they're isolating in their room all the time, those would be signs that this is probably more than just some transient sadness, and it would be worthwhile to bring your child in. Anxiety as well sometimes kids are able to say they're scared, but a lot of times that fight or flight response turns into angry outbursts, temper tantrums. If they don't have the words to describe their anxiety, you get the blow-ups instead. With teenagers, sometimes it'll advance to the point where they're having panic attacks. or you see them avoiding situations that they're frightened of. Maybe a teenager who had some social anxiety at the beginning of COVID, now he's not having any social interactions, and their anxiety is increased to the point that they're not able to participate in school or able to do activities they need to do. Again, if anxiety is interfering with your child's life, that would be a red flag that it's time to get some help.
Another good question that a parent asked, how do you talk to your kids, or what do you tell them if they have a friend who's been diagnosed with COVID or gets sent home because of a virus exposure concern?
Well, again, this would depend on developmental level. Probably most teenagers would be able to understand. But thinking about a younger child, talking in terms of germs, in terms of being sick, concepts that kids already know, and keeping things as concrete as you can. There are also a lot of resources out there for parents to help communicate with their kids. We talk a lot about social stories for kids with autism, but social stories, which are pictures about a situation, can be really helpful in helping kids understand the pandemic, understand social distancing, understand why they're wearing a mask. So again, a lot of resources that are out there for parents.
Dr. Jones, is there any sort of a timeline for when we might get the all clear from COVID?
Well, that's a really good question. I wish I could tell you. I think most of us expect it to go along on this level until it no longer goes along at this level. We're still ramping up. There was a nice little lull in the second half of May, another surprising little lull in the last part of July. So the ramp up of exposure and new cases that we saw related to increased summer activities and group activities. Clearly in Kansas and in Shawnee County, we're still kind of ramping up. We have significant numbers of obviously community acquired cases. The majority of cases, there's no clear link to a source. So lots of activity. That doesn't mean it's inevitable that everybody's going to get sick. It's a situation where we can still make a difference. And that's on an individual level. And we're talking to kids, so we're talking about families can make a difference. People that work in the community can make a difference where they work. So I am still comfortable being at work. I'm still comfortable being in town, running errands when I need to, when I'm able to do the right things. I still like talking about doing the right things because they do work. They do make a difference. It's not inevitable. It's far less than inevitable that we're all going to get sick. It's very, very doable, but it unfortunately requires everybody to do hard things and be diligent about it. And none of us are going to be perfect 100% of the time, but if all of us are doing the best we can most of the time, we can have some level of control and we can have some degree of normalcy. It's going to be normalcy wearing masks probably for months. I can't see, I'm sick of wearing a mask at work, but I don't see an end to that. I'm not comfortable when I don't have it on because I don't want to put myself or put people around me at risk. So if the vaccine is widely available and if it's highly effective, even then it's going to be all the way probably through the influenza season before this will definitely be dropping off. It's going to happen. It's not going to go on forever. The virus will probably get used to us and attenuate a little bit. It's happens with other pandemics that second and third waves may be less aggressive, but that doesn't mean they're not less contagious. And it's still going to require some level of protective immunity, which we're not seeing yet before that happens.
Part of what you said might address one person's question, which is if a child or adult has a health issue and is unable to wear a mask, what can they do to protect themselves? And part of what you said is part of the answer is that's why all the rest of us should be wearing a mask to protect that person who is unable to. But what else can someone who is unable to actually wear the mask do to stay safe?
Distance and hand hygiene and avoiding people who are sick And again, the family can help, and family members can help by focusing on their opportunities to be safe, their opportunities to avoid infection. So that's not a family where an individual should be careless. It may be impossible, absolutely impossible for everyone in a family not to have some risk of exposure. So even in a family setting, social distancing and hand washing will make a difference. I don't think most families, my family doesn't, when we're by ourselves in our home, we're not wearing masks all the time. We are very conscientious about how close we are, and certainly how interactive we are when somebody doesn't feel well, and we would take that to another degree when someone is ill. Masks are of greatest benefit when you wear one to others. So the individual who can't wear a mask, how protected are they even when they wear a mask? That's dependent on how they use a mask. And that's been a concern since March, since February, when we started talking about this, that you watch people that aren't used to wearing masks, they can't keep their hands off their masks. They can't keep their mask over their mouth and their nose. They continually scratch under the mask. They do all manner of things that make the mask of no value. So the simple answer isn't simple. People who can't wear a mask should try wearing a mask. They are available in all manner of fabrics and designs. Some people simply cannot. If they can't, then they're going to be dependent on the people around them to keep them as safe as possible. They're going to need to maintain distance. And what I mentioned before, there's pretty good science to suggest that 6 feet does make a difference. You're not going to be able to maintain that 100% of the time, but an instant of time, a minute here and there, is not going to put a person at very high risk. Even if you can't wear a mask, you're able to wash your hands thoroughly every time you're around individuals. If you do have a need or a necessity to shake somebody's hand, if you really have to do that, you've got a hand that needs to be washed. So that's going to continue to be protective and keep people as safe as we can if we do all the other things right.
Very good. A lot of great questions coming in. Dr. Wilson, our friend Whit says hello, and she'd also like to know your advice for being able to get used to doing all of this learning online. That really gets back to that whole social thing again. If you're used to talking and physically seeing people, but now you have to interact with this screen. What are some advice to prepare for that?
Well, first of all, hi, Whit. I think for all of us, being realistic about the online learning. For some people, for most people, sitting in a chair for hours at a time, as adults, sitting through long Zoom meetings is hard. So being realistic about planning breaks, if you're a person and sitting is hard, then maybe set things up so sometimes you can sit and you can transition to standing. Build breaks into your day and reward yourself on those breaks. So if you sit through the long, boring lecture, then planning a little reward for yourself, whether it's something that you like to drink, maybe a walk outside to get a little bit of exercise. And again, being realistic, sometimes it's just going to be hard. And feeling lonely and isolated means finding other ways to reach out and connect with the people in your class. And again, I'm addressing this more to older students because it applies to younger kids as well, but then again, it will be parents kind of structuring and supporting. So if you have a young child with ADHD, planning their space so that they can transition from chair to standing and building in activity breaks. If you have a kiddo with autism, then planning a way to reduce sensory input if they need it, or to add some sensory input if that's helpful. If it's easier to hold some modeling clay or something squishy in their hands, if that helps concentration, that helps.
Good advice. We had a question come in, Dr. Jones, and it's actually something that we're going to start seeing, and it has happened at some schools already. So say there's been an exposure through a sports or activity in a school, and those who were exposed, be it other team members or whatever, are told that they now must not do the activity, must stay isolated or quarantined for 14 days. if they get tested at some point in there before that 14 days is up and it comes back negative, can they safely return to the activity or to their friends? Or do they need to serve out that entire 14 days, even if they got that negative test before that time? Why or why not?
Well, the standing quarantine orders on a county level, state level, and from the CDC, the presence of a negative test does not eliminate the need to quarantine. That is based on the studies of people where there's a known source of exposure in this outbreak. So this dates back to January in China and more recently in the rest of the world. So the limit of, as far as they can prove transmission from an infected person to a non-infected person, was 14 days. That was the outer limit. So it could take 13 or 14 days before you'd have a positive test. It's felt that after 14 days, there isn't science that would suggest there's incubation of that duration. So the incubation is the key. Knowing when to test, when to run a test. If they're going to become symptomatic, an individual who's going to become symptomatic on day 8 or day 9 probably would not have a positive test until day 6 or day 7. And similarly, if you're not going to become symptomatic until day 13 or 14, it would be a day or two before you develop symptoms when you would have a positive test. So it does not get you out of quarantine if you have a negative test. And currently it's hard, very difficult to provide testing for individuals who don't have symptoms just because they're in quarantine. We just do not have access to enough testing to test all those individuals. And even if we did, when do you test? You test on day 1, day 4, day 13. It still doesn't influence the quarantine.
So the whole 14 days you need to do. Another person was asking, this goes back to the influenza and COVID seasons overlapping. How do you know if you should get tested for COVID or if you should get tested for influenza? Or are there some protocols that you all are starting to think through and develop that you're going to be doing both tests?
So the tests that we're able to do locally, we're dependent on the manufacturers of the platforms of the tests and how they're designing their test materials. And it's my understanding that going forward on a level that we're doing here in Topeka, the in-house testing we're doing, we're only going to be able to do tests for both influenza and COVID-19 virus, possibly another virus. There'll be 3 and 4 valent tests that we're going to be running. So we're not going to be able to do it individually. We'll still be able to send off individual COVID-19 tests to the reference labs. And right now that's about 75–80% of the testing that we're doing is going to reference labs, and the high volume reference labs will be doing individual tests. We already have antigen tests, rapid tests in point of care settings for influenza. Those are available now. We will have molecular tests for influenza, which are more accurate, going to be more sensitive, combined with molecular tests for COVID-19. And hopefully at some point, at some level, we'll have point of care testing for those. A clinical decision, the influenza is treatable with Tamiflu. Again, not the greatest treatment, but certainly has benefit if it started early. So that's a reason in this setting, whether you have COVID that's acting like influenza or influenza that's acting like COVID, you're probably going to have tests for both.
And we'll start getting into that season where there's going to be that judgment call being made. Dr. Olson, what are some of the resources that might be out there for kids who are struggling with the depression that we talked about, or even some of the anxiety?
Well, first of all, kids who are struggling, especially if it's schoolwork related, I'd encourage parents to reach out to school staff, to reach out to the teacher, let the teacher know if there are issues going on. As far as depression and anxiety, there aren't really specific COVID resources because most of us have incorporated treating COVID-related depression and anxiety into our new normal. I know here at Stormont Behavioral Health, we see lots of children and adolescents who are dealing with depression and anxiety related to COVID and behavior problems related to COVID. So most mental health providers, I'm sure that Family Service and Guidance Center is a resource, plus private practitioners in town as well.
You're muted.
Family Service and Guidance Center. I knew one of us was going to forget to unmute at some point tonight, right? Family Service and Guidance Center, behavioral health, private practitioners. Dr. Jones, did you have an addition as well for resources?
I was just so worried about you being muted. I didn't hear your whole question.
So for you, Dr. Jones, because I know one thing Dr. Wilson will talk about is just like that great medicine of being able to get outside and get that fresh air. But what are the safe activities that we really can do? Are some activities truly safer than others? How can we judge what's going to be safe for our kids to get out and participate in?
Anything that an individual does by themselves outdoors is perfectly safe. Anything that can be done in the wide open spaces with good distancing between participants is perfectly safe. Taking it a step further, what can you do indoors? Again, the best you can do if it's not a crowded interior environment and there's adequate spacing. And again, assumptions are made if people are participating in anything indoors, whether it's organized or unorganized. They're not going to show up. They're not going to be part of that activity if they've been ill or if they are ill. They're not going to be part of that activity, or they're not going to be participating if they're supposed to be in quarantine because somebody at home is in isolation because of confirmed COVID-19. So all of that is so relative, and there's so much trust involved, things that you cannot control. You can't control the circumstances of all the participants unless it's only the people that you have complete control over. If it's yourself, if it's one person of any age, I think you're going to be fine in an open environment, running around and going nuts all by yourself. That's fine. What can you do with others? And that's all about distance and all about the health of the individuals and their ability, everyone's ability to be conscientious at every levels that include their home environment or their work environment when they're stepping into that setting.
Let me also ask you this, because already we have people contact us and say such and such school had a case and we're still going back tomorrow. Such and such school had a case and we don't feel like we all were told. So if your child's school has a case of COVID-19 somewhere in students or staff, what things should you be looking for that the school has done or is doing to feel confident that it's okay really for the kids to be going back? Do you need to shut down a building for a few days every time there's a case? Or realistically, what steps should a parent just look at a school and say, okay, I can feel comfortable with this?
Well, I'm understanding and I'm predicting the schools will be very transparent about the nature of the exposure. Isolated case, an individual who's tested positive. Most common scenario is what we're seeing in healthcare. Somebody came to work and became ill that day, or somebody worked and the next day they became ill and were tested. Same thing will likely happen in school. And so identify a child in a particular class that is now home with a positive COVID test. I think the schools intend and have been transparent about that. They would identify probably for all patrons of that school that they had a case in one particular class and that they've investigated that case and they've determined that social distancing was in place. No one had more than an instant of contact and everybody was 6 feet apart. Everybody was wearing masks. Both parties were. They would identify that, as we do in healthcare, as a low risk or virtually no risk exposure. And I think class would carry on. I think that's what they're designed to do, and that's what they've done. The hybrid programs where not everybody's in school at the same time, so they can set up these classrooms with 6 or 8 kids in a class so that they can be supervised and supported and have a classroom opportunity. So I think that's what's going to happen. I believe that that carries on into other activities at the school. That's my understanding that it does. It's designed to be as safe as it can possibly be designed. Like in healthcare, there's going to be circumstances every day that you didn't think of. We do that every day, or not every day, but at least once a week. We come up with a scenario that we weren't exactly ready for. That's just the nature of this as it evolves. And we haven't tried starting school with COVID-19 in the U.S. until just now. Just getting started.
And schools have worked
learn a little bit as we go along.
Yeah, I was just to say schools have worked very hard on developing those in-depth plans. And Dr. Wilson, from the mental health standpoint, what proactively could we maybe say to our kids if there's been a situation where we're suddenly, and the education commissioner said he kind of expects there are going to be situations, because as Dr. Jones said, this is the first time we've gone back to school with COVID-19 around. There are going to be some quick reactions school districts make where the kids are doing their regular learning one day, and then the next day, sorry, we have to switch to all remote. So then they go back to school. And that can produce a lot of anxiety for kids, I would imagine, because suddenly they're thinking, well, is it really safe, or am I going to come back from school harmed? So how do you proactively talk to your kids when they're preparing to return to the building to reassure them that those steps have been taken?
So I think one thing that helps kids manage anxiety is having a sense of control. So we can, especially with younger kids, we can talk about how the building is clean, but what will really give them help them reduce their anxiety are things that they can do. So helping them practice hand hygiene, helping them talk about how wearing a mask keeps everyone safe, practicing what that social distancing looks like, and making it as concrete as possible, because 6 feet is kind of hard for a lot of kids to picture, but maybe 3 big steps apart is easier. Practicing that, talking about things they can control, is a good way to help with anxiety.
And as we've been talking here, Topeka Public Schools Board of Education just voted to postpone their football season another 2 weeks. So they're postponing another 2 weeks. Silver Lake, because of some exposures from staff to coaching staff and potentially students, they've delayed 2 more weeks. Dr. Jones, we did have a parent ask, should they be sanitizing any items daily? Should they be sanitizing the book bags that the kids bring back home from school every day because the book bags have been around other kids, or anything else that they should be worried about cleaning every day after school?
Oh, I don't believe, I think it's clear that the transmission of this virus is person to person, and proximity and time and all those other things that we talked about. It's known to potentially contaminate inanimate objects and surfaces, so that is known. Again, the likelihood of contaminating a household from a book bag is probably very, very small. It's not zero. If you want to wipe those things off, that would be probably prudent, and I'm guessing a lot of people will do that. I think the simple things are the most important things. Again, I know at the schools, part of their sanitizing program includes surfaces that are high touch. And for the most part, I don't think we need to do that at home if we're healthy and if we're being careful in our environment. But that may be something that people want to do. And if they have kids in schools, maybe they want to up the household sanitation. I'm not sure that it's very practical to sanitize everything. I don't think that's the risk that we have in perpetuating the pandemic locally or regionally. I think it's still going to rely on personal behavior and person-to-person interactions.
Do you know at this point yet, Dr. Jones, a person had asked, will they be able to get a flu test this year at their primary care provider, or will they instead be directed to call the hotline and go through that method?
Really good question. So I happen to know the primary doctors want to be able to see their patients. They don't want to send them all to a respiratory clinic. On the other hand, we're trying to serve the elderly and diabetic population that really do need to come in and weren't able to come in April and May. So we're working out means that we can safely see them in our clinics. So I think the plan, the way I've understood the plan, I've been in part participant in some of that planning, is to increase the numbers of respiratory clinics that we have. And so people with respiratory symptoms, with or without fever, will probably be directed to not just one respiratory clinic, but multiple locations. In some smaller clinics, it probably will be maybe a certain time of day, just to keep the cross exposure from occurring. So a lot of time has been spent working on these plans. There probably will need to be a pediatric clinic that is set up for respiratory patients, just to try to segregate the interaction between patients. if you still want to have the opportunity for well child visits, you don't want to have a waiting room filled with people with influenza or perhaps COVID while you're waiting. So there's a lot of work going into that. I think for this winter, there's still going to be some segregation of respiratory symptoms and non-respiratory complaints that would lead you to a provider's office.
I'm laughing at this next question came in as the middle of 5 children. Someone would like some advice, Dr. Wilson, about siblings dealing with each other at home when they're all stuck together remote learning. How can you avoid those conflicts between kids? Get off my Wi-Fi.
I don't think it would be a question of avoiding, rather minimizing conflict between siblings. Again, thinking about physical barriers if it's possible. If it's possible to separate them into separate rooms, even to put up some kind of cardboard divider, and planning breaks, getting outside for some fresh air. Some, kids are used to recess and physical activity, and building some of that in as well. In general, a lot of the conflict comes when we're all feeling stressed out. So just thinking about general stress coping, and that's physical activity, some kind of positive socialization that's not the siblings, and doing something creative. If they can paint or draw or play an instrument or do a craft, but thinking about basic stress coping too.
And I also wanted to ask, as I was listening to Dr. Jones address that question about whether or not to sanitize objects, I know a lot of schools do have policies this year where kids are going to be using their own supplies, but we teach our kids to share, and we want to be nice. And if my friend Judy needs a crayon, I want to hand it to her. But I've touched that crayon, and now I'm going to get close to Judy to hand it to her. So how do we teach our kids that, it's nice that you want to share, but this year, maybe if your friend needs something, the better thing to do is to ask the teacher to get it for her?
And this can be, again, depending on your child, rehearsal can be really helpful. That making a game of it at home. How do you share? What things are okay to share? Pretending that you're a child asking for a crayon and having your child say, no, this isn't a sharing year, or whatever language you want to use. But practicing those skills, because it is a change. Just like we practiced saying thank you and please and practice sharing last year.
And we just have a couple minutes left. So Dr. Jones, to recap, because someone was asking again, so if you get a negative flu test this year, will you be advised to get a COVID test?
Good question. It depends on your illness and your symptoms. If you have a flu-like illness and you have a negative flu test, influenza test, I sure hope you get a COVID-19 test. I think it's important to test, and I think that's our intent. We're remembering the testing back when there was a very limited supply in March. You had to have a negative flu test before you could get the COVID test. And again, that's not the situation we're in right now. It's the opposite. There will likely be in multiple locations related to Stroman-Veil and not related to Stroman-Veil tests that screen and identify both infections simultaneously. It's going to be hard, except for the antigen test, which is the simpler test. It's probably going to be hard to get a test that's only COVID-19. It's probably going to have an influenza part in it. There'll still be influenza tests available, but I'm guessing just about everybody's going to get tested for both.
We are reaching our 1 hour mark. So in these last few minutes, if I could trouble you both to share some final thoughts, whether that be the key points you want people to remember, or perhaps where they can find further resources or information. Dr. Jones, let's start with you.
So I'll go back to the comment, the way we're responsible, the way we're helping others, and the way we're taking care of ourselves and our family it's all about responsibility and adaptability, the responsibility to be aware of who we are with and how we're with them, how we are behaving in those settings, and how that influences not just us, but the people in our family and the people in our families, friends and interactions. And so for the school age population, it starts with the parents have the greatest responsibility and possibly one of the greater opportunities to go out and inadvertently become infected and bring that into the household. It's important on so many levels to teach this to our children of all ages. The older children have the capacity, I think, to adopt that behavior, and we can have that expectation. And I personally feel this is entirely manageable. I think there's no reason that we have to face the inevitability that we're going to get infected. We need to make every effort to limit the numbers of us that become infected by being careful and conscientious.
Good advice. Dr. Wilson?
I think for parents this year, establishing those solid channels of communication with the school, finding out how your child's teacher likes to be contacted, and in a sensitive way, because teachers are under a lot of stress too, but establishing that communication. And thinking things are so chaotic right now, the more you can establish predictability and routines and positive activities at home, the better off your child will be.
Thank you. And thank you both so much. And thank you to everyone who logged on and joined us. You all had some great questions, things I really hadn't even thought of either. So thank you so much for participating. We all know that COVID-19 continues to be an evolving issue. There are new questions that come up just about every day. So for more information about this global pandemic, we do encourage you to visit the COVID-19 page. They have that on Stormont Vail's website, stormontvale.org. If you're concerned about how you are feeling, your mental health, or the mental health of a loved one, and you feel like you need someone to talk to during this time, you can reach out to the folks at Stormont Vail Behavioral Health Center. They can have some guidance for you to get the guidance you need. Dr. Wilson also mentioned for children in particular, Family Service and Guidance Center has some resources as well. So we are glad that you could attend this virtual event with us. Thanks for joining in the discussion as we all work to navigate this new landscape together. We appreciate you being here and participating. My thanks to Stormont Vail for having me. I always enjoy visiting with Dr. Wilson and Dr. Jones. You both are wonderful. Thank you for sharing your time with us tonight. Have a good night, everybody. Remember all the things we need to do and stay safe.
Thank you, Melissa.